What is egg freezing, how is it done, and what is the cost involved? How many days or how many years can you keep the eggs frozen? Hello everyone, I am Dr. Sanjukta Choudhury from Cradle Fertility Center, Siliguri. Today we will be discussing about a very interesting topic which is called as egg freezing. As women, we are born with a certain number of eggs in our ovaries, which is there for the lifetime. But how does the ovary work? The ovary works in a very systematic way. Every month, once the woman matures, a girl starts her first period. A few months after that, the ovaries will start producing or maturing the eggs which she is born with. In normal language, we can understand that we are usually born with a certain number of eggs. It is like being born with eggs which are kept in a vault, and every month few eggs or follicles are taken out from the vault and one of the eggs mature every month. So now coming to oocyte freezing. What is oocyte freezing? With the help of IVF techniques, we mature more than one number of follicles or egg in 1 month. So it can range from 5 to 6 follicle or eggs to about 20 to 25 follicles or egg, which can be matured artificially in one single month. So during oocyte freezing, what we do is the patient comes, we take the proper consent, we find out whether the patient is fit enough to go for the procedure and whether also there is an indication for the procedure or not. So coming to the indications, who would want to do an oocyte freezing, or why would you want to do an oocyte freezing? It can range from medical indications to personal indication. When we come to about the medical indications, let's say somebody who is very young, not married, and has been diagnosed with cancer and needs to go for chemotherapy. So how do we help preserve her fertility? What we do in that case, we take out the eggs from the ovary and freeze them for future use. Now coming to personal preferences. Maybe somebody has not yet found the life partner with whom she wants to spend the rest of their life, and at a younger age wants to keep the option of fertility possible for a later use. In that case also, personally, you can freeze your eggs and keep for future use. The ideal age would be in your late 20s and your early 30s. Why? That is because after the age of 35 to the age of 50, when you actually attain menopause, the quality and the quantity of eggs drastically decreases in number. So to get good quality eggs, the best time would be in your late 20s or your early 30s. So it is like, you are taking your eggs out at a younger age and you freeze the eggs in that age. So even after 5 or 10 years, you want to use your eggs, though you are around 40 or 45, your eggs will still remain at the age of, let's say, 25 to 35 years. So this is the concept. Coming to the process, initially this takes about 14 to 21 days. So before we decide upon egg freezing, we call the patient a month before that, in which we give them proper nutritional advice and few medicines which help in increasing the quality of the eggs. And then we call the patient on the second day of her period. On the month we are planning for the egg retrieval and freezing. In that case, patient comes on the second day, we do a basic blood test and basic ultrasound, and then we start giving the patient few hormone injections from outside. Now what is the use of the hormone injections? These injections help in getting more and more number of eggs from that one ovary, which in natural cycle would be producing only about 1 or 2 eggs. So basically we are getting about from 10 to 20 eggs in one cycle. Basically for 6 months to 8 months of eggs, we can pull in and collect it at one go. So usually in this process, the patient has to come to the clinic every alternate day or once in 2 days, in which we give the injections and monitor the growth of the eggs or the follicle in the ultrasound machine. Once we see that there is adequate number of matured follicles which contain the eggs, we go for an injection called a trigger. Usually after the trigger injection is given, within the next 34 to 36 hours, the patient is called for a small procedure called oocyte retrieval. So, or ovum pickup. So The ovum pickup process, now coming to the ovum pickup process, that is a daycare procedure in which the patient is admitted in the morning, and under anesthesia and ultrasound guidance, we take out the follicular fluid from the ovaries and immediately check for possible eggs in the follicular fluid. It is a short duration procedure which takes about half an hour or so, but the patient has to be admitted as a daycare for about 4 to 6 hours. The patient can go back home on the same day. There is not much pain involved in the procedure as you are anesthetized, and even after the procedure, the patient is given adequate analgesics and medication so that the patient is fit to go home in the evening only. As soon as the eggs are collected or the follicular fluid is collected through the process of ovum pickup, we send this follicular fluid to our lab. In our lab, the embryologist will look into how many eggs we have been able to retrieve and what is the quality of the egg, and then it is sorted out. The most mature and best quality eggs are then processed and frozen for future use. Now coming to how many days or how many years can you keep the eggs frozen. So according to the laws which we have right now, you can keep your eggs frozen for about 10 years and can use it anytime in the future date. And lastly, coming to the cost. Well, the cost will depend on a lot of parameters. It depends on how old you are, how many eggs we were able to mature, what was the number of injections that were required for the eggs to get matured, and how many eggs we were able to retrieve and store in store. So the cost can range somewhere between, in our center, it ranges between 1.2 lakh to about 1.5 lakh, and sometimes it can be a little bit more or little bit less. Usually for the first 6 months, we have a policy of freezing the eggs without any cost, which is included with your ovum pickup package. And later on, depending on the patient's wishes, if they want to continue keeping the eggs for even further amount of years, the nominal charge is taken for keeping it frozen in the lab. Later on, you can use those eggs for fertility, and it can be done in our center, and if you do wish to go abroad or in another place where you want to conceive, the eggs can be taken along with you.